All this infection, basically, there's a lot of thing about the cleanliness, education, immunization. These are the three things that worked in a large extent. But of course, there are some germs, emerging, re-emerging germs which has happened. It could be dengue. Dengue was not there about 15 years back. Now it is rampant. They go in for infection. So they can come with shock and septic shock and they have problem. Similar way, there are many bacteria or virus which was not there. Now it has re-emerged. So what is happening is the most important thing is when to diagnose it early. If you diagnose it early, we can give an appropriate antibiotic or treatment and the morbidity and mortality comes down drastically. But if it is allowed to sort of go on, they come to a stage where they go in for what is called as a septic shock. From there, to revive a child, this becomes difficult. All the diagnoses depend upon our clinical acumen. Depending upon the clinical signs and the symptoms of a disease, we should make a diagnosis. Example I am saying, like for example, the child's breathing, child's heart rate, whether they have tachycardia or bradycardia, whether the temperature difference between the core temperature and the peripheral temperature, the difference between the central pulses and peripheral pulses, also physiological parameters, like for example, you have blood pressure monitoring, you have echocardiogram to find out the left ventricular ejection fraction, see if the fluids are there in the inferior vena cava doing the ultrasound. These are the parameters we weigh depending upon that. Of course, the bacteriological parameters which we take the blood culture, these are the ones we would get the result only after about 72 hours. We cannot wait so long. So there is what is called as acute phase reactants which have come in a recent about 10 to 15 years, where there is an evolution of a newer diagnostic tools to detect the sepsis. It is not only to detect sepsis, it is very important for us to sort of monitor whether this diagnostic tools also helps us in prognosticating the thing. How our treatment works, whether the child is getting better or not, also it helps. But these diagnostic tools have helped them to make an early diagnosing and prognosticate this thing. There is what is called as a biomarkers which has come in a big way. Like for example, we were using early during the 90s, it's an acute phase reactant called CRP, which to diagnose a bacterial from a viral infection. So they can come with a viral shock also, viral septicemia, fungal septicemia, but to differentiate bacterial so that you can sort of upgrade your antibiotic if it's a bacterial. This is to help us. But in a recent past, in about last 10 years, there is what is called as a procalcitonin as a new drug, new investigation modalities which has come, which is helping. It is little more expensive, it costs around 1,000 rupees in center, but it is still not available in a taluka headquarters or some of the district headquarters. But there are variety of newer tools which are coming, which are called biomarkers. These are little more expensive. Many of them are not available in India. It depends upon what we call as a cytokines, chemokines, then self-surface markers, all this. Some of them are still in the investigative modality. Many of them have been used in the adults, but still not validated in a pediatric. We hardly have any pediatric studies in these things.